So that patient who comes in and says, Doc, I want the Alzheimer pill. What do I tell him? I tell him, I've got a much better treatment for you. There are 159 studies showing lifestyle interventions that prevent dementia. Blood pressure control, Mediterranean diet, adequate sleep, physical activity, social engagement, cognitive training, treatment of hearing loss, smoking cessation, avoidance of binge drinking. All of those things in studies have been proven to decrease the chances of getting dementia. There was a study published by the CDC in 2022, showed 8 important risk factors for cognitive decline.
Okay.
High blood pressure, lack of physical activity, smoking, excessive alcohol use, obesity, diabetes, depression, and hearing loss. If you had none of these, the prevalence of cognitive decline was 3.9%. If you had 4 or more, 25%.
Wow, so this is a much better result.
That's what you can do, right?
Yeah.
It's not about what pills out there. It's about taking care of yourself and doing that early on to prevent dementia.
But we live in America and we love some pills. And I know, well, and also like we've spoken before that our healthcare system's kind of built up to fix as opposed to prevent.
Right.
So it's good to hear this. And
this is an example where it's so clear. I mean, there just isn't any pill, right? There just isn't. And people have studied all kinds of things, and they've studied vitamins, they've studied statins, they've studied anti-inflammatories. There just hasn't been any good data. This is where the data is.
Right. Well, once somebody has, it's hope. There's a lot of people, once you're in that lane of Alzheimer's, you're clinging to anything really, which is sad.